Hi everyone. Thanks for joining me for this week's educational video. Tonight is going to be the first video in a series of probably 2 to 3 videos where I'm going to be talking about the most common lower back condition. If it's not the most common, it's probably top 2 or 3. In fact, it is so common that if a person lives long enough, they're going to acquire this particular condition. And that condition is degenerative disc disease. Now, degenerative disc disease is not going to be our focus tonight, but we're going to try to lay the groundwork, lay the foundation, so to speak, to move forward in that direction so we can get into more detail in subsequent videos. And Charlie Brown may have a lot of insight for us on how we can help manage and help people that have degenerative disc disease. So why do I bring up Charlie Brown? A very good friend of mine about 20 years ago brought me a Peanuts cartoon that he had clipped out of the newspaper. And I was, just to give you a little bit of background, I was helping my friend who had been dealing with back pain for probably the better part of 5 years. I was trying to help him manage his symptoms so he could resume his active lifestyle. So one day he brings me this Peanuts cartoon, and the cartoon is very short, and please humor me while I share this with you guys because, like I said, I came across it while I was preparing for the video last night, and I just thought it was right on point because Charlie Brown is going to have some insight for Miss Aunt Joe that we're going to talk about in a little while. So the cartoon depicts Charlie Brown laying on his back in bed. It's at night. He's staring at the ceiling, and he says, "You know, sometimes I just lay here and I ask questions." So he likes to ask himself questions. Everybody or anybody who follows Charlie Brown, whether it's through older cartoons or through newspaper comics, they know that Charlie Brown's a pretty deep thinker. So the question that he asks himself in the very next caption, it says, what is a very important thing that a person can do in life to make their life successful? And the last caption shows his thoughts or his answer to his question, and it says back exercises. So my friend and my patient thought that was very, very pertinent with me being a healthcare provider and him undergoing back exercises and me advising him accordingly. So I thought I would share that with you guys. So Charlie Brown's answer to his question that he had while he was laying up late at night in bed, I think it's going to provide useful to Aunt Joe's issue possibly. Now, who is Aunt Joe? Aunt Joe is a very nice woman. She's in her mid-50s, okay? She works full-time. She has a relatively active life. She is completely independent. She likes to go for evening walks with her husband when they both get home from work. They usually walk 1 to 2 miles every evening when they both get home from work. So she enjoys that. Okay? Now, about 4 weeks ago, Aunt Joe noticed some back pain. Some back pain that she had had in the past, but it had always gone away on its own. You know, she'd had it for, she might have it for a day or two at a time or 3 days, but it would go away and she wouldn't have to do anything about it. It typically wouldn't interfere with her lifestyle. This time, she's been dealing with it for about 4 weeks. She's not able to go on the evenings walks with her husband, the evening walks. She's not able to stand for prolonged periods. She's also not able to sit for long periods of time and watch movies with her husband or read her favorite book for prolonged periods of time. She finds herself frequently changing positions to get any kind of really noticeable relief. It's interfering with her lifestyle so much that she says, you know what, I'm going to go see our healthcare provider and see if he can help me out. So after waiting for 2 weeks to get in to see her medical provider, so it's now been 6 weeks since she noticed the onset of her back pain that occasionally goes into her buttock and the back of her thigh. She sees her doctor, he asks her lots of questions, and then he does a physical exam, and he goes, okay, Aunt Jo, this is what we're going to do. You've been dealing with this now for 6 weeks. It's not going away on its own like it normally does. I want you to take these medications as prescribed, and I also want you to make an appointment to have this MRI done. Okay? Once you have your MRI done, I want you to call my office back and make an appointment to see me, and we'll go over the results. Okay, so we're at 6 weeks right now. The MRI facility was really busy, and Aunt Jo couldn't get in for about 2 weeks. So now Aunt Jo has been, no pun intended, she's been sitting on this back pain for right at 8 weeks now. So we're going to pick up next week's video at Aunt Jo dealing with back pain for 8 weeks, and now she's made her follow-up appointment with her doctor who's going to go over her MRI results with her. I hope you guys can join me for next week's video. In the interim, please go to my website if you have any questions, if you've had back pain in the past, if you're presently dealing with back pain, if you've never had back pain and you want to prevent it, reach out to me at sylvieconsulting.net. You can see it at the bottom of the video, and we can have a free initial consultation. Thanks a lot for watching, guys. I'll see you next week.